Good morning. As Libby mentioned earlier, I'm Nicole Schumann and I'm the Foundation Secretary. I have the pleasure of introducing our next presenter. Austin Letcher is a Senior Research Associate with the Coordination of Rare Diseases, or CORDS program from Sanford Health. Sanford Health is the largest rural, not-for-profit healthcare system in the United States, and it's headquartered in North and South Dakota. Austin has a Master's of Science degree in Biomedical Engineering, and he's been with the CORDS program for 3 years. He works with patient advocacy groups such as our foundation to promote rare disease research. He has been an excellent partner in terms of launching our registry earlier this year and in providing ongoing support. Austin is here to talk about the participation, or the importance rather, of your participation in the CORDS WSS Patient Registry. Thanks, Austin.
Thanks, Nicole. Can everybody hear me all right?
Yeah.
All right, sounds good. Well, thanks for that kind introduction, and thanks for getting me out to Orlando. You know, I live in South Dakota, so sometimes it gets chilly up there. But yeah, I wanted to just tell you a little bit about. Do I ask you to progress the slides? Okay, perfect. Tell you about the reason CORDS exists, really, is Sanford Health. And I want to talk about this because this really sets us apart from all the other registry platforms out there. A lot of those programs are for-profit, or a lot of rare disease registries are launched by pharmaceutical organizations, which don't always have research in mind. Sometimes they'll hold on to that data and hoard it and not let it be used. So we're here to give all of you a platform to stand on with which you can enter your own data, share it with one another. I've been hearing some people talk about grants and whatnot, and we can use that data hopefully to leverage you to have a better chance of being awarded one of these grants, right? So Sanford Health, as a nonprofit institution, we're not out to make money on this data whatsoever. I just want to make that really clear. We're a healthcare organization, so giving back to the community and the rare disease community is something we truly believe in. And Sanford Research is pretty exciting, actually. It's been growing for about 7-8 years now. Every year we've been getting more and more NIH funding, more and more researchers. We're up to about 39 independent principal investigators now, and believe it or not, we have a 300,000 square foot facility. So it's quite large and very comprehensive. The goal is to have someone focusing on each organelle or each part of the cell. So really we're transitioning into the stage where we could potentially research any rare disease given the right funding opportunity. But we also have a robust clinical trial program, and that's something we're trying to integrate with the hospital system too. And rare disease research, we have about 23 different labs, as I mentioned, that we're focusing on these different cellular mechanisms. Some mainly neurodegenerative diseases. Batten's disease is kind of one we're really well known for. Lipodystrophies, kidney diseases, metabolic diseases. But back to CORDS. So this patient registry is really a patient-centered approach. The key is that this is patient-entered data. It's not clinician-entered, so each and every one of you can give your input and start contributing to the greater good of educating our physicians, or actually having more data out there that researchers could publish, and then leading to more resources for them, and eventually lead to insights for researchers. So CORDS is a patient registry for all rare diseases, which makes us kind of unique. I was really excited when I heard the link about Kabuki syndrome, because we're actually partnered with a couple groups, so whether you know it or not, that's really important. So having data on all rare diseases in one spot is really powerful, so our researchers can cross-reference the data from one disease to the other. So I think that's great that we already have a Kabuki syndrome network. Margot from Kabuki Syndrome Network partnered with us, and then there's another All Things Kabuki group that partner with us too. So I'd like to talk more about that with everybody else offline. But yeah, we're sponsored by Sanford Health, and really it's a smart thing for us to give back to you, right? Because we're in the business of research, right? So if we can empower you to fundraise for research, really that's a win on our side too. So that's one of the other reasons that Quartz does what it does. So the way Quartz works is the reason we can have any rare disease patient enroll is we have a standard questionnaire which has some very, I don't want to say simple, but standard questions on it, like symptoms, diagnosis, family history, whether or not you or your family have donated biospecimen, that sort of thing that really every patient registry should ask. So we get those off right away, right off the bat. And then we work with groups like yours and develop a disease-specific survey, which is online and what I'm here to talk to you about today. So you can find me out in the front entrance over here. I have a few ways that everyone can get started. I just want to plug the website really quick for all of our webinar people. If you go to www.sanfordresearch.org/cords, C-O-R-D-S, you'll see a Enroll Now button kind of in the middle left of the screen, and that's how you get started. Complete your, yeah.
Do you mind repeating that URL? We're typing it in.
Yeah. So Sanford, S-A-N-F-O-R-D, research. There's a D.
Research.
Yep, sanfordresearch.org/cords, C-O-R-D-S. And I'll give you my email at the end too, so anyone online, you can email me, and I can help you out with that too. So that's one way anyone in this room can still go on and enroll. Just go to our homepage and enroll that way. It will automatically shuffle you to the proper questionnaire as long as you choose Wiedemann-Steiner syndrome as the diagnosis. But also ways that I can help you enroll today. I can help you get your account set up pretty quickly within maybe about 5 minutes by taking some basic contact information and emailing you a username and password that you can go and log on at home later. Or I can give you some homework and give you a paper-based questionnaire that you'll mail back to us. Yeah.
I just wanted to mention that there's links to the Sanford Health via the WSS Foundation website too.
That's right. Yeah, you can find it on the WSS Foundation too.
I have a question for Meg. If
Yeah.
I think I registered, but I'm not positive, can I confirm that?
Yep, you can just check with me. I'll be here all day. And even people on the webinar, if you want to email me, that's totally fine too.
What is your email?
Austin, AUSTIN .Letcher, LETCHER, at sanfordhealth.org, SANFORD health.org. Yep.
So like what you're talking about is like when you're doing the research, does it go through with the DNA also?
Yeah, our scientists have just about every fancy bit of equipment in their laboratory, so they do all sorts of DNA research too. What Cords does is a little different. We collect more of the data, so but hopefully that data can help guide where the researchers should start looking, cellularly. I think I'll learn a lot today about WSS, so I'm not familiar with the exact gene, but hopefully the questionnaire can guide us a little more that way. Go. Just go through it. Okay. So yeah, some quick stats about Cords. The reason Cords is cool is because we've actually up to, I think, 28 partners now, almost 700 different rare diseases, over 4,200 people, 55 countries now, actually. So we're really able to leverage the scarcity of everyone being rare in one database, and that's really our goal. So that's what we like to highlight.
So this is a worldwide, this just isn't a US based.
Yep. Yeah, and actually non-English speakers can enroll if they have access to someone who can translate for them. We have about 10 different languages that we can consent people with on the screening form. If they select, say, Spanish or French, they can enroll that way. And we're happy to help people mailing them questionnaires. We work with someone, a physician in Japan that translates questionnaires. So really anything that you guys need, we can do it. Can you help me out? Progress next slide, please.
Oh, it's sorry.
No, it's okay.
Sorry, someone has asked a question. Go ahead.
That's okay. Yeah, so CORDS helps in a few ways. The whole idea behind this is that, I forget who was talking about the registries earlier at Global Genes, but really a lot of these patient advocacy groups, just like yours, have spent thousands and thousands and thousands of dollars to develop this database system. But really, setting up a database system or a registry isn't that complicated. You know, it's been done a lot before. Marketing teams do this, you know, by aggregating email lists and whatnot. So really, we shouldn't need to do it before, and that's why CORDS is here. We're here to quit people from reinventing the wheel. Yeah.
So an online question. It says, my daughter Georgia is registered with CORDS. We're from the UK. Do I need to register specifically with regards to WSS with yourselves? So I guess she's registered with CORDS, but she wants to know if she's registered with you guys?
So I guess I don't understand the question, but yeah.
She may have registered undiagnosed.
Oh, yes, yes, please update. That's a great point. Thank you. Yeah, so in order to be referred to the questionnaire, you do have to submit the WSS diagnosis. And you can call me. Actually, yeah, you'll have to call or email to set that. That's kind of another level of security we have to just make sure you're choosing the right diagnosis. I'd be happy to help out with that.
Okay, thank you.
You bet. So, yeah.
I'm sorry. So there was a registry that was linked to the WSS webpage. Is that linked to CORDS?
Yep.
Okay.
Yeah. So all of our 28 partners basically share the same basic standard questionnaire, like I mentioned. So we kind of kickstart these registries, right? So we say, hey, everybody, the deal with partnering with us is you have to use the standard questionnaire, and then you can ask anything else you want. But if you, as long as you indicate you have a WSS diagnosis, or your child or your loved one, you'll be shuffled to that WSS questionnaire. And that's wherein the power lies, is that now that all these groups don't have to start reinventing the wheel, you guys can focus on fundraising, and that's really important, funding and research. So another point I wanted to mention is that so the CORDS standard questionnaire is kind of like what a registry is, but it's really important to have that disease-specific survey too, and it's really important to go in every year or every time you visit your physician and something changes, because then you can start to track the natural history of this disease and allow physicians and researchers to get a more clear picture of how it progresses. Even though every individual is unique, once you start seeing the whole spectrum, you might be able to view some trends. So this is an important part too that sets CORDS apart, is that the data is owned by the participant. Participants choose to share it with researchers when they're consenting. So participating in CORDS means that your data will hopefully be shared with researchers. But you can also choose whether or not you want to share it with Wiedemann-Steiner Syndrome Foundation, which I'll give you an incentive for why here in a little bit, because then you can start to use those stats to maybe apply for grants and education, community, and all that. And we are governed by an institutional review board that reviews all the ethical and moral principles of our organization, as most research organizations do. So yes, we never sell, rent, or lease any personal information. A lot of those other registries out there, there's some snaky terms in there that do allow them to leverage that. So we just want to let you know that it's participant owned, we're not going to sell it, and you can trust us to take good care of it. So how is it used? Researchers can apply for access, and then a scientific review board meets and just make sure that they have all their checks and balances in order, and then we'll disseminate that data for them for up to a year afterwards in whatever format they need. And as I just mentioned, we do share some of the data with WSS if you choose so. So we hope that you all do that, but also industry can, yes.
So Allison wants to know, she has Georgia's actual lab report from her DDD study. I know it's a in Cambridge. Would it help if she emailed you this?
So I'll actually get into that here in the next slide. We have a document upload functionality. Okay. I would encourage everyone to upload helpful tests or genetic reports. The key to that is it has to be image-based, so it has to be like a PDF or a JPEG, something that's something on our security team decided.
Thank you.
And then if you could just progress to the next slide, please.
Oh, sorry.
So this is one of my favorite things to say. The world experts of WSS are right here today. That's all of you. I just wanted to mention that. That's why it's so important that you enter in the information. You guys are the ones that see this disorder manifest day in, day out. So your information is critical. And I really want to encourage you to just go in and enter that information. Yes?
Did you say that we will be able to access information about the stats on WSS? Like for a grant, we could get all of that type of percentages and things like that?
Yeah, as long as
that just as an individual we can do that, or?
So you'll have to talk to Nicole. She's the authorized user, and she has access to all those reports. There's a monthly summary report that's shared if you want to share that with the board, and but also Excel spreadsheets that if you have any data-minded folks, you just go hog wild with. And you know, we just ask that is used for educational awareness purposes only, and that you funnel the researchers through us so we can check those researchers' accreditations and whatnot. Great question, though. But yeah, so it's really important to update your information as often as it changes annually. I can't stress that enough. But here we are. And also we might add like a new question or a new functionality. So it's just important to keep that up. And there is a document upload feature towards the end if you're using the online version. I guess if you are mail-based, you can mail that to us and we'll upload it for you. And this is just a great way that we can start creating a mineable database. Okay, and as I mentioned, I probably skipped ahead when we were talking about this, but it's really important to collect this data so you can educate new families that are just, you know, newly diagnosed, or like we were talking about, potentially apply for grants. And usually people that hold the decision of whether or not you are awarded that grant, they like to see some stats on it. So yeah, it gives you another, I think I kind of led into this earlier, but it's a great way for you to just give a voice to your community. And as I mentioned earlier, if we start giving researchers more data to access and actually publish, we can start educating more physicians that aren't aware about this position. I didn't do this, but I imagine if we just did a quick PubMed search, which is like the Google of scientific medical literature, you wouldn't see very many Wiedemann-Steiner syndrome publications. So the higher we can get that number up, the more information researchers and physicians have access to it. Next slide, please. Okay, wrapping up, and then we'll get to some stats. So, key touch points, it's free, it's your data, it costs you nothing but your time, so I encourage everybody to come see me today, and we'll at least get your account started. And I'm happy to answer any questions one-on-one all day. If you feel like you have time in between talks, come talk to me. And you know, the thing about participating in CORDS that's really important is you're not just creating a WSS registry, you're creating it in a place where it can be cross-referenced with other diseases that might have similar mechanisms, which researchers could also access that data at the same time. So let's talk about that data. Looks like we have a great diverse group of participants so far. About 50% of the population of our registry is born in the US, but you see there's a lot of UK folks, which I think we heard from just earlier, Canada, and throughout Europe. Most of the kids so far seem to be male, 64%. And average age of diagnosis, with a wide variance yet, that's because we need more people to enroll, is about 6. And average IQ is about 64, with a 90% confidence interval that is somewhere in between about 60 and 68. This is another surprising result. I don't know, maybe for you, Nicole, but primary method of feeding is oral, so I don't think there are quite as many tube-fed children as maybe we thought. And kind of split 50-50 with the GI issues. About 50% of the WSS kiddos seem to have some GI issues. Important to note, constipation is one of those highly ranked in the other category. And it looks like the vast majority of participants do struggle with some sleep issues, with snoring and delayed sleep onset being two of the highest, and night sweats as well. Mean number of hospitalizations, 4 hospital visits, and average number of surgeries is about 3 surgeries, with most of our WSS kiddos having gone under some sort of speech therapy, physical therapy, and occupational therapy are some of the highest therapies that they're involved with. And then this is an interesting chart here. Average age of milestones for walk, speaking words, speaking phrases. Both walking and speaking were right about the age of 2 so far, and speaking phrases about 3.5. Becoming bladder trained about 4, and bowel trained about 4.5. But yeah.
So is there someone that verifies the patients for that patient group? So, you know, there are kind of 2 layers of diagnosis. You do a clinical diagnosis, tends to, some of them have Wiedemann-Steiner, some may have something else, or then you can do a molecular confirmation. So this data, is that clinical diagnosis or is it molecular?
The answer is probably both. We do have a question on the court standard questionnaire that asks how they were diagnosed, so whether they had genetic laboratory analysis or whether it was a physical or clinical diagnosis. So this would be all the data just from all of those cohorts.
But the problem sometimes is that some of the variants in the gene, we're not sure whether they're disease caused, but some we're completely convinced about. So
okay.
It's just kind of nice to hear that you have all the data.
Yeah.
So you could probably extract the data based on that.
Yeah, I think, Nicole, you ask a genetic variant question, right?
The questionnaire goes into a little bit more of the specifics. Is it in the KMT2A gene? There's a couple with the KMT2B gene, and even how it was diagnosed with exome or specific lab tests.
So we could filter this data out by those questions, and then hopefully the more people that upload their genetic reports, that's another way we can more have a higher level of confidence that the data is accurate. This is kind of just a teaser for all of y'all to start sharing with researchers. Yes? So there are about 45 enrolled right now, which doesn't mean that all 45 have actually completed the entire questionnaire. As you can see here, the BAL trained, we only had about 14 people answer that, and that's usually probably just because it's towards the end of the questionnaire and you haven't gotten there yet. But so hopefully by the end of this conference, within next week, we'll have well over 100, I hope. So, well, all of them, yes, 250, or how many is it, 300? So yes, enter your data in. If you're having issues or anything, try to use your laptop or your desktop. It does work better for that. And I think this is the last stat I have. Participants with educational support. So again, speech therapy seems to be a huge educational support. One-on-one aid along with modified instruction, physical therapy, and behavioral supports. But you can see, every case is unique. And I just want to play this last video for you really quickly. I think it punctuates my talk nicely. If we have time.
There are about 30 million people in the United States affected by nearly 7,000 rare diseases. Connecting all these people is crucial, because each person plays a role in bringing us closer to the causes, treatments, and cures of rare diseases. Making those connections is the mission of Sanford Research. We established CORDS, the Coordination of Rare Diseases at Sanford, a national rare disease registry designed to accelerate research into these rare conditions. A rare disease is one that affects fewer than 200,000 people in the United States. Why would you want to enroll? You believe researchers will find cures and improve treatments. You want to assist researchers as they conduct studies. You want to participate in clinical trials and other research opportunities. You want to support your local healthcare providers or rare disease organizations and networks. Enrolling is easy. Visit the CORDS website to tell them you are interested. CORDS will send you the details needed to enroll. And then they will contact you annually to update your information and share opportunities to participate in research. So if you have a rare disease, are a member of an organization that supports people with a rare disease, or if you know someone who is eligible, visit sanfordresearch.org/CORDS to learn more and enroll. Only then will we be one step closer to putting the pieces together and seeing the whole picture and the crucial part you play.
Thanks, everyone.
We have one more online question.
Okay.
So regarding the average milestone ages, what if you've never reached these milestones? For instance, somebody has a 13-year-old who's nonverbal. How would that be represented?
I think, yeah, that's an option on that question.
Okay.
So yeah, it just depends on how we filter that data out. I didn't get too specific on filtering that out. You could really go down a rabbit hole with analyzing that data.
But there's a way to represent that on the questionnaire.
I'm glad you're all so excited
Thank you.
about the data. Yes?
Is it possible to get the data set or updates to the data before people register with the numbers would change essentially?
Right, yeah. So reports are uploaded monthly, and what WSS does with it.
Quarterly post.
Yeah.
Thank you.
Yes?
I wondered about privacy concerns with the data. And I also wanted to know if there's a way to be notified if your child's data isn't ready, so that you could reference the publication and maybe let you know that your child is in there.
That's something that we've been asked about before, and I think that's a great idea. We haven't typically done that before, but I think the first request I had about that was about a month ago, so I think going forward, we will try to share that with our families that have their data accessed. So, yeah, look forward to that. Thank you.
We're just about to go into a 5-minute break, but I just wanted to reiterate and kind of speak to the last question that although the information is shared when you check those boxes, it's still de-identified. So like the information we get as a foundation is similar to the slides. It talks about, the sex, the age, but it's not attached to anybody's name. So I just wanted to be clear that although your information is shared, it is de-identified. And also, right now our sample size is 45, so it's crucial that we have 100% participation. So I just want to encourage anyone to ask myself or Austin any questions you may have and to seek him out to get that process going of registering if you haven't done so already. Thank you, and it's time for a 5-minute break.